Hello everyone, welcome to US Residency Training and Beyond. In this video, we will discuss about good patient care. I am Dr. Viswanath, Aluru, attending physician in physical medicine and rehabilitation at Optional Health in New Orleans. Good patient care comes with good habits, good principles. As an intern or as a resident physician, we already discussed about some of the principles and practice of the good resident or an intern. So let me tell you my experience as a child when my parents used to go to a family physician. When I went with them, there were always like 30 to 40 patients in his clinic. I was always wondering like why this clinic is so busy. What is so great about this doctor? So I started closely observing him when I went inside. So the first thing, he starts like very early, like 7 o'clock in the morning. And in those days, people used to check your radial pulse, and so the gentleness in the way he actually handles the patient, and the softness in his voice, so creates like almost like a soothing, relaxing environment, and the way he listens to the patients, like when they are talking, and the way he establishes patient-doctor relationship. So all these things made him a really great doctor, great physician. So these are the qualities that we have to practice every single day as a great physician to deliver the best possible patient care. So gentleness, and so establishing good relationship with the patient, the family. So when we count our interactions, starting from the morning when you get the sign out from an on-call physician until you sign out to another physician in the evening, when you count all the interactions with your patients or family members, we have to make each and every interaction right, perfect interaction. So that's how you deliver a best possible patient care and also best possible patient experience, which matters because we act as a team. You're not the only person delivering the patient care. So you work with your senior resident, your chief resident attending physicians. You also work with the nursing staff, other allied support staff, if you're rehab resident, your therapy staff. So each and every interaction of your team member is very important to provide that utmost patient care. So you have to remember that people don't usually come to us if they don't need us, right? So they come to us only when they're not feeling right, when something is not going right with them, with their feelings, with their emotions, or with their body. That means they're kind of in a vulnerable situation. So we need to address, we need to accommodate, we need to accept the situation, and we need to address the situation, and we have to make sure that they feel comfortable, they feel confident, they feel safe, that the therapy or the treatment that we are providing is going to heal them. We have to help them in the healing process and make sure that they get back to their home or community in a safe environment. So that's what accounts to good patient care. So you see the patients in various environment. You see them, as a consult. You see them in the emergency room or some other department or in ICU, or when you decide to bring the patient to your department and you're attending service, you admit them and you see them on a day-to-day basis. So, and also you might see them right before surgery or during surgery or immediately after surgery, post-op period, or you even see them as a follow-up in your clinic or as a new patient for the first time in the clinic. So you have several settings or several situations where you actually meet the patients or the family members. So it's important to know that in what situation you're seeing. You need to know the situation first, and also you need to know the acuity of the situation. Is it something that you have to act immediately? So what are the first things you need to do? What are the next things you need to do? So that's why it's important that you have to, the way you actually gather the information, the way you actually organize the information, the way you assimilate that information, and the way you address that information, and the way you communicate that information, and the way you document that information, and the way you follow up on the information. So all these steps, they account to the good patient care. So when someone calls you with something, right, first of all you need to verify that information. Once you verify that information, then you need to act on it. Action. And act on that information, then address the information. So once you address it, then you verify again to make sure it's done. And then you communicate that information. Communication with the patient, with the family, with your care team members, including your senior president, your chief president, attending physician, your staff, nursing, communication. And then you document that information. So these are the steps you have to do every time to actually provide at most good patient care. So you verify, you act, you address, you verify again, you communicate, you document. So when you look at all these interactions with your patient or family members in a whole day, you can say which interactions went really well and which interaction did not go very well and why they did not go very well. So when you can review those interactions at the end of each day, address those things, then you can actually do better next time when you encounter a similar situation. So that's how you provide the best possible care. So we all strive to be the best physicians, and remember, you are still in training, so you're not independent yet. So your actions, so they directly affect your physicians, attendings, and the program director or the chiefs that you're working with. So you always have to keep in mind and always keep them informed, ask for help when needed. That's how you work in a team. So that's how you deliver the best possible care. So I want to thank all the physicians in training and in practice across the globe who are celebrating this Doctors Week. Thank you for your contributions for the best possible care every day, treating and advocating for the patient and the family members. And with this, I'm going to end this video. In the next video, we will discuss about each of those situations where you see the patients and how you need to act in those situations. For example, whether if it is a consult situation, or whether it is an admission situation, or whether it is like a pre-op, op or post-op situation, or whether it's ICU situation, or whether it is an emergency room, or if you're seeing a patient in a clinic or for a procedure. So in each of those situations, how will you act and how will you deliver good patient care? So once again, thank you for listening and watching my videos. I hope these videos are informative. I will see you all again in the next video. Thank you. Bye.